Good morning, everyone. Welcome to Pediatric Grand Rounds. Thank you for joining us. If you are in person, please join us in the Mill Mountain Conference Room. And thank you for joining us virtually as well. We do have breakfast, if that's an incentive today in Dr. Musick's honor, so please come on down. Our speaker today is Dr. David Musick. He joined the faculty in administration at Virginia Tech Carilion School of Medicine in July 2013, having worked in medical education since 1992. As Senior Dean for Faculty Affairs, he is responsible for oversight of faculty affairs and faculty development activities for VTC as well. Professor in the Department of Internal Medicine, he has extensive teaching experience in a variety of formats, including small group facilitation, didactics, workshops, case-based learning, and online content delivery. His research interests include assessment and program evaluation, social and cultural aspects of medicine, medical professionalism, leadership, biomedical ethics, spirituality, and medicine, and the faculty well-being. Please join me in welcoming Dr. David Musick.
Thank you so much. It's really a privilege and honor to be here today. I really appreciate the opportunity to come back and talk with you a second time about this topic, spirituality and religion and medicine. I was here last in October. I'm sorry, not in October, in August, and gave sort of a part one presentation, more general on this topic, and I'll touch on that a little bit, but today we're mostly going to look at some research findings related to this topic. So it's kind of like we did part one, which is the general overview. Some of you may have been there for that. I see a couple of faces that probably were, and then today we'll do part two. So because this is a CME event, I'm required to make a disclosure. I have nothing to disclose. I sometimes wish I did, but I don't. Let's get that out of the way that way. We have a couple of objectives today. We're going to briefly revisit the role of spirituality in healthcare. As I mentioned, that was the topic of a prior presentation that I did for an hour back in August, where we made more general comments about this topic. And then today we're going to really focus on the second objective, which talks about expanding our knowledge base regarding the research literature on this topic. And hopefully this will provide you with some meaningful information and spur you to do some additional research on your own if you're interested in this particular topic. So I'll start with a quote here from a handbook, something called the Handbook of Spirituality and Worldview in Clinical Practice, was published a little over 20 years ago. And it talks about how religious and spiritual issues are inextricably woven into patients' lives. And this particular handbook says that although how this may impact the clinical care of patients differs from patient to patient, the assessment of a patient's worldview, in other words, what that patient feels is his philosophical or her philosophical outlook on life, is relevant both to diagnostic formulation and treatment planning. We talked quite a bit about that last time in terms of how people are interested in this and how it sometimes influences the type of care that they would like to receive from their clinicians. Now we want to talk a little bit again about the difference between two terms here, spirituality and religion. So spirituality is generally considered a broader term. It really refers to whatever gives a person a sense of ultimate meaning or purpose in life. Sometimes, in fact, often that references a deity of some type, a higher being, a creator, but not necessarily so. That's not the case for everyone. And there are important regional or geographic differences. Here in the southeastern United States, I think our population is generally viewed to be as a bit more religious than maybe in other parts of the country. So spirituality is the broader term, whereas religion is often viewed as kind of a subset of spirituality. It's described as kind of a working out of spirituality, or how do you give behavioral expression to your spiritual beliefs? What do you do in response to that? And so much of this literature focuses on religion because that involves certain behaviors that can be observed. So some examples are listed there. Participating in meetings of some type with folks who share your belief system, or prayer, meditation, reading some type of sacred literature. These are considered aspects of religion because they're observable behaviors. And they reflect the more general spiritual beliefs that you may have. So very important to keep those two terms in mind, and I will tell you that much of the literature focused on research pertaining to this topic naturally focuses more on religious behavior because that's more easy to observe. Harder to get inside somebody's head and research what they're thinking. So as a consequence, a lot of the research focuses on religious behavior. Why is this topic important? Well, there have been many, many surveys, as we talked about last time, where patients have indicated an interest in this. Specifically, patients often express an interest in having the opportunity to talk about this with the clinicians who are taking care of them, whether it's a physician, a nurse, whomever it may be. They really want to be able to discuss that, at least in certain circumstances. Not all the time, not every time, but a lot of times this is something that's forefront in their minds when they're interacting with you as their clinical caregivers. There's also growing evidence that supporting patients' spiritual practices may improve health outcomes in a variety of cases or conditions. That's what we're going to focus on for most of our time today, is what is the evidence that that is so. So when you think about this whole area of discussion, it really applies to three very broad subtopics that concern the interface between clinical medicine and spirituality and religion. Number one is, how does the patient view her or his illness and suffering? How do they make sense of it? Number two is the patient's ability to cope with that particular illness. What skills do they draw upon in order to cope with and handle, so to speak, whatever illness or condition they are facing? And then finally, how can the clinician support that idea with their patients? What should or shouldn't they do, and so forth. Now, Dr. Dana King, who is a family medicine physician, wrote a book about this about 25 years ago. A little bit controversial at the time, but he suggests for physicians that there are 4 levels of physician involvement in the spiritual concerns of patients. And he says level 1 is something that all physicians should be able to do. And that consists of taking a spiritual history from a patient, which is something we talked about last time, how to do that and so forth. And then how to properly engage a chaplain, member of the chaplain team in care, when and how to do it. He says that's baseline. All physicians should have the ability to do that. All the way up to level 4, which is where he suggests that you might be involved with counseling patients of different types of faiths, praying with them, and then you see the 2 levels in between there. So again, it's just an interesting way to think about physician involvement on a continuum. So, to kind of sum up the refresh or the revisit of the general topic of spirituality in healthcare, it seems that over the last 20 to 25 years especially, maybe a bit longer, that there's been a really increasing interest in this topic by both patients and clinicians. This is a growing emphasis in health professions training programs. I think I mentioned last time that in 2003, the survey showed that there were maybe a handful, 5 or 6 medical schools in the country that were mentioning this as part of their formal curriculum with medical students. Whereas now, I think it's probably the opposite. All of them, except maybe a handful, have some mention of this. I know in our curriculum here at VTC, our students are exposed a little bit to this in the doctoring course, where they're learning how to interview and take histories and so forth. And this comes up in terms of a spiritual history. And then also, I would say in summary that not all patients want this emphasis or expect their physicians to address it, but many patients do. There's lots of surveys and other data out there that indicate that. So let me stop there and see if there are any questions. Anything online? Anybody want to make any? I know I went through that rather quickly. That's kind of a brief summary of what we talked about in detail last time, but any thoughts or feedback or questions at this point? Okay, then we'll keep on going. So I teased you with this last time. I said, if you're a clinician and someone offered you an intervention that would increase life expectancy, help patients cope with their illness or conditions more effectively, and improve their ability to recover from illness, would you be interested? I think most clinicians would probably say yes, I sure would. But what I'm suggesting is that the literature indicates that an emphasis on spirituality will do these things. We'll see. Now, probably, if you look at the research literature on this topic, the single variable that's probably been studied the most is mortality. So what impact does religious behavior or spiritual beliefs or some combination of those have on life expectancy or mortality? There have been any number of studies on this. It's probably the single most frequently studied variable in this regard. One of the early studies shown at the top here, which was published in 1999, but it was based on a 10-year national sample of 21,000 U.S. adults with 10-year follow-up as part of that National Health Interview Survey. And what they found is that the life expectancy gap between those who attend religious services more than once a week and those who never attend is over 7 years. And for African Americans, adults, the life expectancy gap they found was 14 years. That's pretty interesting. So if you're involved in some type of religious services and you go more than once a week, what this study would indicate is you're going to live 7 years longer than somebody who never goes. And if you're African American, you're going to live 14 years longer than somebody who never goes. I'll let you ponder on that just for a minute in terms of, okay, if that's true, what are the implications of that? You know, maybe we should write a prescription, attendance at worship services 2 times a week. I don't think anybody's suggesting that, but I mean, it kind of pops into your head, right? Because it's something that could have an impact. So this is one of the earlier studies that got a lot of attention because of the national sample and the follow-up approach that they took. About that same time, there was a meta-analysis that looked at the effect on mortality of participating primarily in religious type activities. And again, this study was pretty well done because it controlled for a total of 15 variables. So independent of sex or race or age or socioeconomic status, etc. This study found that your chances of living longer were 29% higher for folks who were, quote, religiously active. Now, having said that, we need to think, well, what is it about participating in those types of activities that would contribute to living longer or a better mortality rate? You can speculate on that. Is it the actual religious activity itself? Is it the interaction with people? Is it the fact that the norms of the group put more emphasis on being healthy or avoiding certain types of unhealthy behaviors? All of that probably contributes to that in some way. Again, there have probably been about 25 prospective studies in the past 40 years that have looked at mortality. So there's a large body of evidence out there if you're interested in following up. And not all the studies show this impact, but a lot of them do. So it's fascinating to think about. I think I had this slide in there last time as well. So if you look at the overall literature on this and you think, well, what all different types of things have been looked at, or what types of things have been variables in some of these studies of the impact on health that spirituality or religious belief practices can have. Here's a partial list. So if you go to the literature, you can find studies that are associated with each one of these topics and how patients' ability to recover from things like chronic pain or deal with chronic illness, recover from addiction, how they do with their cancer treatment, spinal cord injury, and so forth. You'll find studies about all these things and looking at religion or spirituality as a contributor to that. So whatever you're interested in, there's probably something out there along these lines for you to look at. Also, if you're just getting started in this field, you'd like to look at it from the standpoint of who are the real giants in the field, who's doing most of this research. These 5 names will come up rather quickly. I believe Dr. Carilion and Dr. Koenig now are both at Duke. Dr. Carilion used to be at University of Chicago, I think, but I believe he's at Duke now, if I'm not mistaken. Dr. Koenig is very well known in this regard. He's a psychiatrist who has been at Duke for a number of years and actually was one of the people who started the Duke Center for Spirituality, Theology, and Health. And they have a very nice publication that comes out every month called Crossroads. So if you keep this link and want to sign up to get this, it will deliver you this usually 2 or 3 pages newsletter, PDF newsletter into your inbox. And most of it is made up of summaries of research going on in the field. I like that a lot because it keeps you up to date on what's happening. So I would encourage you to subscribe to that if you're interested. Other names, Andrew Newberg is now at Jefferson. I have another slide on him just a little bit later. Started out at the University of Pennsylvania. That's where I knew him when we were there at the same time. fascinating neuroscientist kind of person, done a lot of studies with the brain and how that interfaces with spirituality. Ken Pargament is a psychologist and a researcher, I believe at Bowling Green State University, and has done a lot of work in this regard. Then Tyler Vanderweel is also very well known for his research. He's at Mass General, Harvard, I believe. So these are some of the people, if you start looking in this field, you're going to run across these names. And if you're interested in doing more digging into this, you wouldn't do bad to kind of just go and look at each one. Pull up, search for all articles by Carilion or Harold Koenig, and it'll really get you started. So, when I was thinking about putting together this talk, I thought, I'm going to enlist the assistance of my good friend. I'm now calling him Dr. C. You can either go Dr. Copilot or Dr. Chat GPT, but I refer to him as Dr. C. I'm somebody who's like just barely stood my big toe in the water about AI, whereas I know some of you are probably using it a lot more than I am. But I thought maybe this would be an example. What would happen if I asked Dr. C about this topic? So in September, here's the question I asked Microsoft Copilot. I said, can you tell me approximately how many studies exist concerning the relationship between spirituality or religion and health outcomes? I did this more as a curiosity than anything else, just to see what would happen. And the answer I got, which was too long to put in here, but I'll show you some more in just a minute. The answer said numerous, hundreds, and referred me to several meta-analytic studies involving, quote, hundreds of high-quality articles. So I thought that was kind of impressive. I mean, I'm well aware of the fact that artificial intelligence can have these hallucinations and sometimes give you the wrong information, so I had to be careful with this, but I really did it more for my curiosity than anything, and it actually was helpful. And so here's some of the articles that it came up with. I'm going to talk about a couple of these in more detail in just a minute. They came up with quite a list. So I followed up that question. I said, all right, Dr. C, what are the common health outcomes associated with spirituality? Very general question, kind of a broad question. And here's what the response was. I'm not going to read it entirely, but you'll have these slides, I assume. And again, it talks about the first thing on the list is what? Mortality, greater longevity, which is consistent with what I said earlier about that's probably the most prominent thing that's been studied in this field. Also mentioned improved mental health, better coping skills, enhanced quality of life, reduced substance use, and so forth. So it gives me references for all those things. So again, if you're interested, pull up Dr. C yourself and see what she or he says. I don't know whether it's a she or a he, but I use Copilot most of the time. I think that's installed now on everybody's computer. Copilot, to me, so far has been a little more susceptible to what I would call hallucinations than Chat GPT. A lot of people in my office really prefer Chat GPT, so I'm not smart enough to know what the difference is or why it would matter. But anyway, you can repeat that yourself and see if you get a similar response. That kind of helped guide me a little bit in terms of, which studies, because of all the hundreds of studies out there, I was thinking, how do I really address, how do I summarize that in one brief talk? How do I go over that literature? Well, you can't really. I mean, there's just so much out there. People are now making their research careers, based on this topic. So a little difficult, but I did select a couple that I wanted to go over. And in particular, this first one, I'm going to dwell on this one a little bit because this study came out in 2022. It was done by a group at Mass General Boston, Mass General Harvard. And this is likely the most comprehensive literature review on this topic available. So I would say that if you're not going to read anything else about this, if you read this one article, you would really be brought up to speed pretty quickly on the field and on what the literature shows. It's a very nice, comprehensive analysis. They started out looking at serious illness and spirituality. They looked at almost 9,000 articles. They boiled that down to 370 or so. And then additionally, they went beyond that a little bit and focused on health outcomes, which meant that they found 6,500 articles and boiled that down to about 215 articles. They had rather strict inclusion criteria. I meant to bring those with me. I should have put them in the slide. But for example, they only looked at prospective studies with certain levels of sample size and So it was a fairly strictly organized synthesis of the literature. And what they did, they actually did a combination of an extensive literature review and also a Delphi expert panel. I don't know if you're familiar with the Delphi technique, but this is where you get together a group of experts and you show them basically information. You have them rate the information over several iterations until they kind of reach consensus on the most important aspects of whatever the issue is you're studying. It's a very commonly used research technique. So they did both. They did the big extensive literature review and they also had a Delphi panel. And they focused their inquiry on two general areas. The first one I called spirituality and serious illness. So how does spirituality or religion impact folks with serious illness? What does the literature tell us? And then secondly, sort of related to that, but with some difference, what is the impact of spirituality on health outcomes? So they reviewed the literature from a 22-year time period, and in this study, they provide 8 evidence-based findings and 3 suggested implications for each of these 2 areas. So let's take a look at those. Again, the Delphi panel, 27 experts from across the board in terms of disciplinary representation. They had folks from medicine, nursing, chaplaincy, social work, mental health care clinicians, even public health policy type folks, ethicists, etc. And this group was deliberately designed to represent a wide variety of different viewpoints on this topic and traditions, as well as a good mix of different groups based on demographics, ethnicity, and so forth. And this group was assigned to qualitatively synthesize and assess the evidence and offer implications for healthcare. So that was their charge there. And they had an iterative ranking process for their final list of implications. All right, so in regard to the area of spirituality and serious illness, here's their 8 evidence synthesis statements. This is based on the broad, in-depth review of the literature and their attempt to say, this is what the evidence tells us about spirituality and its role in providing care for people with serious illness. And you can read there the different findings. Spirituality is important for most patients, according to their review. It can play a role in medical decision-making. Number 4 and number 5 is interesting. According to their review, spiritual care is something that is frequently desired by patients with serious illness. However, at the same time, the spiritual needs of patients with serious illness are infrequently addressed in medical care. And they speculate a bit in the study about why that might be the case. Unaddressed spiritual needs, number 7, are associated with poorer patient quality of life for patients with serious illness. And then the provision of spiritual care is associated with better patient end-of-life outcomes. So these are all very important synthesis statements that they came up with based on this general topic of spirituality and serious illness. And in terms of implications, what does that mean? Here are the 3 top implications: that clinicians, number 1, should routinely incorporate spiritual care into their care of patients with serious illness. It ought to be a part of what we do with every patient with spiritual illness. With serious illness. Number 2, we should include spiritual care education in the training of members of the interdisciplinary team. This is not exactly new. People have been talking about this for probably 30 years now. And this goes back again to what I said earlier about how in the early 2000s, there was only 4 or 5 medical schools that paid any attention to this at all. Now it's a prominent part, or at least a part of the curriculum of almost all medical schools. So I think we've made some progress in that regard, but they still found, based on this more recent literature, that we have more work to do there. And then finally, their third implication statement is that we should include specialty practitioners of spiritual care, for example, chaplains, in the care of patients with serious illness. So that's their findings for that first category, spirituality and serious illness. The second category they looked at is spirituality and health outcomes. So this is where they took a look at the different aspects of spirituality and how it might really impact particular health, illness, or illness outcomes. And what they found is it was not too surprising. These things have been out there for a while, so a lower risk of mortality, we talked about that, less use of, or less engagement of what we might think of as risky type behaviors, whether it's substance abuse, use of alcohol, marijuana, tobacco, etc. Subsequent better quality of life, also with better mental health outcomes, fewer depressive symptoms, fewer suicidal behaviors, and they found that there's a dose-response relationship between frequent attendance and lower risk of mortality, something that we talked about earlier that other studies have also found. And what about their implications for this part of their review? Again, the top three ranked by their Delphi panel. Number one, healthcare professionals should recognize that this is important and particularly consider the benefits of what they refer to as a, quote, spiritual community as part of their efforts to improve well-being. I take this to mean that it would be a good thing for healthcare professionals to talk with patients about the benefits of being in some type of group setting where their beliefs are shared with others and how that will be impactful on their health. Now, how exactly you would do that, I'd be interested in your thoughts about that. That'd be a little bit tricky. The second implication was that the education of health professionals and students regarding this topic must be a priority. That repeats from the first part. And then finally, their third one says spirituality must be recognized as a social factor associated with health, joining other such factors that we already know about, such as social integration, economic support, protection from discrimination, access to healthy foods, et cetera, et cetera. So this is where you talk about the conditions, the disparities, and things like that that have an impact on folks' health. And what they're suggesting is that spirituality is just as important a social factor that impacts health as these other things. Okay. Here's some statements, some summary statements by the authors. Dr. Balboni was the lead author. She is a professor of radiation oncology at Harvard Medical School, associated with the Brigham there. And she talks about how this study is really the most rigorous and comprehensive systematic analysis of the modern day literature regarding health and spirituality to date. I looked this up last night. This study was published in 2022. It's already been cited, I think, close to 300 times, which is pretty impressive for a study that's been out about 3 years. I was thinking about this and comparing it in my head to my own Google Scholar profile. I wish I had any type of article that was cited anywhere close to 300 times for my whole life, you know. 300 times in 3 years is pretty impressive. I think the last statement there, the one that I've highlighted in red, is also important. It says, these findings indicate that attention to spirituality in serious illness and in health should be a vital part of future whole person-centered care. That we should have more national discussion about how to incorporate spirituality into this type of care. So that's what they call for. Here's some additional verbiage from their conclusions where they talk about, you know, when we're talking about this and thinking about this, we really have to think pretty hard about how to practically apply this in the clinical setting. It's not a one-size-fits-all. You know, it's very individualized. And while it has the potential to improve well-being for patients, we have to be careful with this. And I think they're wise in pointing this out. But they're also very firmly calling attention to the fact that this topic should be included in the training that we give to our clinicians, and that we just have to be careful how we think about implementing this, because it's a very highly individual type thing. Okay, that's the Balboni study. Let me stop there and see if anybody has any questions or thoughts or feedback on that particular study. Yes, ma'am.
I have a question. So how do we apply all of this body of data to pediatrics? Because I'm assuming most of it is taken from adult population.
Yeah, great question. I'll repeat it. The question is, how do we apply this in the pediatric setting? I've got some stuff in here about that. But it's a very important question because this does actually have a lot of application to pediatric populations. Now, probably more so on the adolescent, the older pediatric patient. That's probably the group that's been involved in most of these studies. But there's also been some studies reflecting pediatric cancers and interacting with the parents of pediatric cancer patients or parents of folks with children in the NICU or PICU or whatever. So yeah, that's out there. Great question. We'll come to that. Yes, Lydia?
Yeah, the previous,
This one?
at the very end, it says, how can you incorporate this into value-sensitive care? I'm interested in what you think they mean by value-sensitive, because HSSIP, I'm thinking value-based care as in financial,
Yeah.
or is it values?
I think they're probably referring to the latter. The question is the value-sensitive care part of this quote. Are they thinking about value from the standpoint of financial value or more from the standpoint of patient values? I think it's probably the latter, would be my guess. Great question. But I think value-sensitive care is probably referring to the values of the patient, and if a patient really desires to, for example, have the opportunity to talk about this with their clinician, they should have the opportunity to do that. That's my guess. Anything online? All right, we'll speed along then here. So here's another study that Dr. C came up with for me. And this has to do with the association between spirituality and religious and quality of life among healthy adults. Again, we won't dwell on this one nearly as long, but the objective of this study, which was very well done, was to assess the association between health-related quality of life and what they called spirituality or religiosity among healthy adults. The majority of the participants in this study were college students. There were about 10 studies that met their strict inclusion criteria. 9 of these were cross-sectional, so that's not as strong a design as obviously as a prospective type study. 1 was indeed a longitudinal cohort study. 9 of the 10 studies reported a positive association between health-related quality of life and spirituality or religiosity, while 1 study found no significant association. The key components that they looked at in this study in terms of influencing health-related quality of life included optimism, inner strength, peace, high control, hope, and happiness. And their conclusion was higher levels of spirituality and religiosity were associated with higher health-related quality of life, at least among this population of mostly college students. In the author's quote here, whether linked to a particular religion or not, intrinsic spirituality seems to be an interesting strategy even for those young individuals not facing significant health complications. So again, I haven't seen that many studies that focus on that particular age group, young adults, healthy college students. So I thought that was an interesting study. Okay, let's get to your question a little bit, which is, how about pediatrics? Well, there have been a lot of different studies. I'm not going to go over all these, obviously, but I've given you some here that in case you wanted to follow up. So these are, some of these are more recent. The one on the bottom left, 2003. I didn't put the date on the one bottom right, so I'm sorry about that. But the 2 at the top, one from 2018, one from 2019. And you see, again, complex pediatric decision-making, pediatric oncology. Here's some more. Prevention and management of depression and anxiety in young people, effectiveness of spiritual interventions on psychological outcomes and quality among pediatric patients with cancer. So again, oncology has been the subject of several of these studies. Spiritual coping, psychosocial adjustment, physical health in youth with chronic illness, C-sections for the paraviable, fetus, and home birth. This has to do with patient values. That's probably similar to what the other authors were saying. Here's some additional nurse strategies to provide emotional and practical support to the mothers of preterm infants in the NICU. Systematic review and meta-analysis. Again, spiritual interventions among pediatric patients with cancer, systematic review, and spiritual dimension of parenting a child with life-limiting or life-threatening condition, systematic review. So you'll notice that a lot of these I put in there are systematic reviews, because those are more summary articles that you can get a better grasp of the overall literature on this. And I'm giving Dr. C credit for finding most of these. Now, here's an interesting study from 2006 that focused on this topic in terms of adolescent health outcomes. So again, another review type article. The key findings here in this study, which is about 20 years old now, religion and spirituality is significant to adolescents and is generally seen as a protective factor against negative health outcomes. The study reviewed literature focused on proximal domains of religion and spirituality rather than just attendance at religious services. Now, this was an attempt to really figure out what folks were thinking and their belief system inside their head, which is a little more focused on spirituality, a little less on religious behaviors. Constructs like spiritual coping and religious decision-making were often positively associated with health outcomes in this particular review. And then the study highlighted the need for better measurement of proximal domains and suggested some areas for future research. So if you're interested in adolescent health in particular, this is a good review study to take a look at. Spirituality and well-being of children, adolescent, and adult students, the scientific mapping of the literature. So this is a 2021 study, and it's looking at trying to map the literature on students or learners' spirituality and well-being looking at current and historical research trends. They find there this was a little bit different in that they used bibliometric analysis to map the literature, including citation analysis and H publications. Now, anybody familiar with bibliometrics? That's like citation index, journal impact factor, H index, I-10 index, these types of alternative metrics. And they took this approach and looked at the literature a little differently. They tried to find the ones that looked the strongest in terms of these types of analyses. And they pulled those studies and looked at those. And the findings that mostly showed a positive association between student spirituality and their well-being. And it also found that there's a growing interest in how spirituality impacts well-being, particularly in the context of mental health, resilience, that sort of thing. Now, we hear a lot today about well-being, obviously. Not that many studies that try to link well-being with some type of spirituality or religious factor. So this was noteworthy, I think, for trying to do that. Okay, coming down the stretch here. I think I had this slide last time. So this concept of psychoneuroimmunology is fascinating to me. Now, I'm not a clinician, so my understanding of this is limited. But there's lots of folks who are studying and feel like there's some connection between health outcomes or illness outcomes and such things as forgiveness, hope, stress and anxiety. In other words, what role does the mind and one's attitude or one's spiritual beliefs, proximal beliefs, play in immune system functioning? Fascinating topic. Lots of studies in this area. If you just do a literature search on that topic, you'll find a lot of studies. I mentioned earlier Dr. Newberg. I met him when we were both at the University of Pennsylvania. This was over 20 years ago. He actually came down to East Carolina and spent a day and a half with us there and gave some talks when I was down there. And he's now moved over to Thomas Jefferson in Philadelphia, but fascinating neuroscientist who studies the relationship between brain function and spirituality. And it says here he's considered a pioneer in the neurological study of religious and spiritual experiences, a field known as neurotheology. I didn't pull anything on that term. It would be interesting maybe to go back to Dr. C and say, what do you know about neurotheology? And just see what it comes up with. But he does a lot of brain scans of people engaged while they're actively engaged in various types of religious or spiritual activities in an attempt to better understand how that impacts the brain. And he's written a couple of books, very provocative. He asked the question, is there a God gene built into the brain? Is there something built into our brain that's hardwired that makes us have some type of desire for spirituality or some type of belief in some ultimate purpose in life? Very interesting. Is there an anatomic locus or neural network that predisposes humans to spiritual experiences and acceptance of belief? Maybe that's a different way of stating the first question. And then if that's true, can it be developed through spiritual practices like prayer, meditation, whatever? So if you have this predisposition to spiritual experiences, can you exercise that? Can you build it up? Can you make it stronger? Very interesting questions. And he tries to answer this by looking at brain function. If you want to look at his webpage, it's very, very interesting and very provocative, so would refer you to that page, but fascinating guy. Now, as we sum up here, let me stop there and see if there are any other questions or comments before we get to the last few slides here. Anything online? Everybody's asleep, right? I'll put them to sleep. It's early in the morning. Get some coffee in here.
We got caffeine here in the middle.
That's right. If you come in person, you get coffee, you get juice, there's a lot of incentive to show up in person, right? Cinnamon rolls. Yes, sir.
I think the last slide was absolutely fascinating,
Yeah.
okay, about the possibility of a God gene. You wonder about scientists like Francis Collins, who, C.S. Lewis is another example of somebody who initially was an atheist and discovered the Lord. Yeah, this is really fascinating because, as scientists, a lot of scientists, a very high percentage are atheists because they strictly go on empiricism. If they can't see it, they can't measure it, they can't directly observe it, then they will not allow the possibility or can't come up with the possibility that it exists.
Right.
Okay.
Right.
So, I mean, I think spirituality, I think is based on a belief of another dimension that we can't see. Just basic concepts about arguments for the existence of God. And there's about 4 basic arguments for the existence of God, which I won't get into. But this is truly fascinating, I think, and to think about how that's related, how this might be related. Because it's just like with spirituality, you can't really, in religion, it's about faith. You can't prove it per se.
Right.
You have to go through, you have to be able to see that other dimension, but you can't measure empirically.
Yeah.
And I think that's truly fascinating research.
Yeah, it really is.
From a person of faith. Being
Well,
a
I
person
think with or without proof, this is what David's showing us.
Yeah, I mean, without proof of the existence of
There's an
God.
impact.
Right, that this is truly very fascinating
Yeah,
research.
it's a very interesting area of inquiry. The idea of a quote-unquote God gene is not new. I mean, that's been around for a while. Dr. Newberg sort of took that idea and put it on steroids, so to speak, and just really did a lot of work focusing on that particular topic. Very interesting. I remember one of the most fascinating conversations I ever had on this topic was with a medical student. This was many, many years ago at another school, and the student had listened to one of my talks about this, and then later went out into clinic and met some patients, and this topic came up right away. And this particular student told me that he was an avowed atheist, that he did not believe in any type of deity, higher being, or anything like that. But he said, I was really fascinated to have that conversation with the patient, and I tried my best not to focus on what I thought, but to focus on what was important to the patient. And so he said he was able to participate, at least he thought, effectively in listening and reflecting and entertaining that patient's statements and beliefs and responding to them appropriately. And I said, man, that's you have really just provided a good example of what this is about. It's really about the patients and what's important to them. But it is a topic that is controversial, and for some people it's a really tough topic because it forces us to think ourselves, which goes to your comment about, well, what is it that we ascribe to in terms of our belief about ultimate purpose of life? And for a lot of people that involves a deity, and for a lot of people it doesn't. But it's a topic that makes us think about that. And so, yeah.
But it's interesting when you're saying God gene or God module,
Mm-hmm.
pretty much what it's saying is it the same as a hope gene?
Mm-hmm.
Because we want to believe, especially when times are tough, medically or otherwise, that there's something else that exists.
Mm-hmm.
So it's not, I don't know, I mean, for me, when I'm listening, it ties in very significantly. It could be one or the other, like there must be hope, there must be better. There must be the chance of a possibility of something different than exists right now, right here.
Yeah.
And you can call it God gene or a different gene.
Sure, yeah. I mean, the hope gene or the God gene or the forgiveness gene, however you want to look at it, it's very important. The question is, if somebody has hope, where does that come from? Is it innate or is it based on something? It's a fascinating question. If you talk with people, if you talk with patients who are suffering with clinical depression, for example, where does their hope come from? If they have hope, where does it come from and how do they get it? Very, very interesting. Yeah. Okay. Oops. All right, so before we finish, I think it's fair, we have to also talk a little bit about the literature that reflects some negativity associated with this topic, just so that we're balanced and giving a holistic point of view. So we all know that historically, religion in particular sometimes has been used to justify very bad things, whether it's hatred, aggression, prejudice, whatever it might be. You don't have to have a really in-depth understanding of history to see that. So, sometimes religion, we talk a lot about religion and spirituality being positively associated with good things, but to be fair, religion sometimes is associated with not so good things. So it's just important to point that out. Social networks, including those associated with spirituality and religion, can be sources of both support and also stress. Sometimes people, particularly when they're involved in a group, whether it's a church, whether it's a mosque, whether it's whatever it might be, temple, some type of organized group of folks who share their same beliefs, that's often a good source of support, but it can also sometimes be a negative thing. And that's in the literature as well. Feelings of religious guilt can contribute to physical and mental health symptoms or disorders. I didn't include it this time, but last time we had some case studies on the screen where one in particular, a young lady had been divorced from her husband and found out sort of third hand that he had AIDS. So she went in to be tested for AIDS and she was positive. And her statement in the case scenario was that she felt like she was being punished by God for being divorced. Now, if she says that to you as her physician or her clinician taking care of her, what response do you make? I mean, it's hard, right? You may have had this come up, and how do you deal with that? Because it's a feeling, it's an overall feeling of guilt that God has done something bad to this person because of their behavior or whatever. So that's out there. Patients' reliance on, quote, faith healing instead of appropriate medical care has led to negative outcomes. There are certain religious groups that, for the most part, do not believe in healthcare, do not believe in medicine. So if somebody gets sick, and you've probably heard of these cases, in particular in the pediatric world, right, where parents have a very sick child and probably taking care of that child and correcting whatever the problem is would be relatively easy, but because they don't believe in medicine, the child gets worse and worse, and in extreme cases even dies. And you hear about this, you read about this sometimes. And I think it's really, really unfortunate. But that's out there. And then finally, religious doubts or struggles have been associated with a higher risk of mortality. So if you look at some of these mortality studies, you'll see that sometimes if people are going through struggles related to their belief system, that it actually increases their risk of negative health outcomes, including mortality. So that last one is very meaningful to me. I've had my share of ups and downs in life, as we all have. And when the bad things happen to you, it's natural to struggle a bit with your beliefs, and you wonder, what it means. And so, again, to be fair, we have to recognize that religion sometimes is negative for some people. Enough said. Oops, keep hitting the wrong button here. All right, so what are some of the challenges in terms of research in this field? Well, certainly the idea of what exactly are we measuring is a real challenge. Again, I said earlier that most of this literature focuses on religious behaviors because that's easier to measure. You can observe people's religious behavior or ask them to tell you about it. But sometimes it's really hard to figure out exactly what are we measuring. Dr. Koenig published a recent paper where he talks about how measures of spirituality and religiosity, are often, quote, contaminated with measures of mental health. Not quite sure exactly what he means by that, except that some of the scales that people fill out talking about their belief systems are often overlapped with mental health things. And so he's trying to make a clear distinction between mental health type items versus measures of purely spirituality or religiosity. And sometimes the scales sort of blend the two inappropriately in his mind. Correlation certainly does not imply causation. We need additional prospective studies to really enhance our understanding of the relationship between exposure to spirituality and the timing of health consequences. So you can find a lot of studies that say, this particular type of religious behavior is correlated with this. Well, as we know, that doesn't say that one caused the other. It's just an association. So we have to keep that in mind. And then there's really a lack of cross-cultural studies, or, for example, a variety of faith traditions or non-U.S. locations. This tends to be a literature that is based primarily on studies in this country, not so much in other countries. So that's probably a weakness in the field as a whole. Okay, so to kind of wrap this up, You think about research, there are really three questions that you can talk about in general. Number one, is there an association between variables? Number two, is the relationship valid? And number three, is the relationship causal? I think in all three of these areas, we still have a lot of work to do in terms of this literature. A lot of the literature reflects association, but does not reflect causality in any way. So you have to keep that in mind. And so the research, while not necessarily conclusive, does indicate that the subject warrants further investigation and should be taken seriously, even though it's challenging from a methodological standpoint. So I'm going to throw these summary statements at you. I think I may have had this in the last presentation. These are from Dr. Koenig's book in 2001. And here's some of the things that he says when he's trying to sum up the literature. He says the following: people who attend religious services have lower IL-6 levels, better immune response. People who attend religious services regularly, read holy literature, and pray often have lower diastolic blood pressure and are hospitalized less often. People with strong religious faith are less likely to suffer depression and recover from it more quickly. So again, that was Dr. Koenig's statements about 25 years ago. We could probably talk and debate about each one of those. There's literature probably that would support these, and probably some literature that would say, hold your horses, not necessarily. That's the way research is. It's messy. You have contradictory findings sometimes. But overall, this is what he's saying. Dr. Koenig is probably the most prominent researcher in this field. He's been at it for a long time, very well respected. Hundreds of studies have examined this relationship between various illness states and spiritual or religious practices or coping mechanism. The results are mostly positive in terms of the impact. Not always, but mostly positive. And it doesn't seem to matter which particular faith system is espoused by the patient. Whatever faith system is important to them can have some positive impact in terms of their illness outcomes. Other summary statements: patients often want their physicians or other clinicians to address spiritual concerns. I think I mentioned last time there was a study that talked about how 1 in 2 hospitalized patients would like to discuss this with their physician. Been repeated many times. So that means if you go on the inpatient unit today and you see 20 patients, 10 of those people or more would like to have the opportunity to talk to you about this. Are you ready for that? Are you feel prepared? Do you have the time, etc.? It's challenging, but it's there. Patients' spiritual or religious practices may have a positive or negative impact on health outcomes. The majority of research seems to indicate that it's positive, but not all. And then finally, we have to approach this very cautiously and be very patient-centered. This is not a one-size-fits-all approach. Go back to my example of the med student who basically said, it's not about me, it's about the patient. Whatever the patient feels is important, that's what I want to work with. Finally, some food for thought. A professional can't allow his or her own beliefs to so dominate the practitioner-patient relationship that what is important for the patient is never allowed to surface. Another big name, Dr. Solmacy, a general internist as well as an ordained Jesuit priest, I believe, in that tradition. Written a lot about this. His book called The Healer's Calling is really, really good. And finally, patients need to be heard at a meaning level and not just at a disease level. Being heard at a meaning level can itself be profoundly therapeutic. There's something about being able to talk with your physician about this that really is helpful. And I've had a couple of conversations with my primary care physician about this. I didn't expect him to do anything about it. I just wanted to tell him, this is important to me. In particular, recently, as I've been through some personal tragedy, I've had that conversation with my own physician. And it was immensely helpful just to tell him about that and have him reflect back to me and express his support. That's all he did, but it made a big, big difference. Okay, that's the end of my talk. Now, I'm told because this is for CME, I have to ask you some CME questions. I'm not, how do we do this? Do I just throw them up on the screen?
Throw them up, throw them out.
All right, good. Throw them up and throw them out.
Don't draw down.
All right, brace yourself. These are going to be really, really difficult, okay? First question. The term spirituality is best defined as A, participating in a house of worship. B, that which provides a sense of ultimate meaning or purpose. C, communing with nature. Or D, an organized belief system consisting of creeds, rituals, and documents. What say you? B. B, whatever provides a sense of ultimate meaning or purpose in life. That is a person's spirituality. Now, for some people, that could be communing with nature. But that's really not the most precise definition. D is really more of a definition of religion as opposed to spirituality. Okay. Question number 2, the term psychoneuroimmunology, one of the longest words I've ever seen, is best defined as A, a field of study that examines complex interactions between the brain, nervous system, endocrine system, and immune system. B, a conceptual framework that addresses how chronic stress can have significant effects on immune system function. C, connections between illness outcomes and such things as stress and anxiety and willingness to forgive and hope. Or D, all of the above. You're right, it is D. Congratulations, you all passed with flying colors. I'm really grateful for the opportunity to share these thoughts with you. I hope it's been meaningful. If I can ever help you in any way with this or any other topic related to faculty affairs, please don't hesitate to call on me. I'd really like to be of service, and I thank you.
Dave, you don't get off that easy. I got a couple comments.
Yes, sir.
I had to tell you. I'll talk faster for when I talk. One, first is an infomercial. Carilion Children's has a YouTube channel with all these CMEs. Why do I bring that up? Those of you who didn't catch part 1 of Dr. Musick can go to that channel and catch it, because his summary was delightful, but the first session was even more so because it was much more robust. So please take the time to do that if you did not see his August presentation. Number 2, Dr. C was tasked by Dr. Musick, so take credit, David. I did look at Dr. CH. I was multitasking back here, and there is a segment on neurotheology, and it talks about that.
Awesome.
Isabel, one of the impacts is on the parent when you talk about it, potentially, because they're the modeling and the formative kids. And the last would be a really interesting one, is what would be the reverse question? What is the effect of spirituality of the care team, the caregivers, on the outcomes and the care we provide? And I don't expect an answer because we're probably out of time.
Yeah, that's really an awesome question. In fact, Andrew Tressler, who is the person in charge of the chaplain services, he put together a group recently, and I was part of that, a very small part of that, who turned in a RAP grant to kind of look at that. Unfortunately, he wasn't selected through this initial round, but it's really a fascinating question because, and this is very prominent in the nursing literature, probably read more about this there, but what impact does the belief system of a particular clinician taking care of a patient have on the outcomes, and does that have anything to do with it? Fascinating topic. I don't think it's been studied very much, but if it has been, it's probably more in the nursing literature. Great comment. Thank you.
I wonder, as I've gotten older, what is the connection with spirituality and dementia and Alzheimer's? And is it something to do with beliefs, or is it the social connection that is intrinsic to many of the religions?
Yeah, I'm not as familiar with that literature, so I really couldn't tell you. But it's a fascinating topic. It's how does this impact the care of patients with Alzheimer's and their outcomes? I bet you there's some studies out there.
Yeah, I wonder. Thank you so much.
Thank you.
Thank you very much.